I'd like to thank all the panelists for their insight and their ideas. And now we're going to open it up for questions from delegates, and Emile has the mic. And we have till about, I'd say, approximately 12:10. Questions?
I was looking around, and I'm looking at the panel there, and I'm not going to let you off that easy. My name is Carl Crevar. I'm with the Ontario Network of Injured Workers, and I just want to make some comments. I think I mentioned yesterday what we're doing with the Ontario Network of Injured Workers is that and particularly in the injured worker movement, we're saying enough and we're taking action to move forward to make things better. Just to comment on a little bit of the stigma. I don't know how many of you saw it. About 2 years ago, there was a cartoon. This is how stigma works. There was a cartoon in the Ottawa Citizen newspaper. And it projected a person in a wheelchair being pushed towards a person in front, and the caption was, "Don't touch me, I'm an injured worker." I took very strong offense to that. We took very strong offense to that. We actually went to the Ottawa Citizen and said, "Take that caption out and you tell me who's sitting in that wheelchair." Because that's how stigma, whether you're a person with a disability, whether you're a veteran, whether you're an injured worker, but that stigma that's attached there. The other thing I want to say, I am very controversial, and I find it somewhat disturbing when I hear the numbers, particularly coming out of the 50% of people with disabilities are unemployed, or the 98% from Neil in the Indigenous community that are having problems. That's disturbing to me. What that says to me is that if we lose sight of the human value, then we are a dead society. All people are equal and deserve to be treated equally as well. And that's going to be, I think that has to be a focus in any strategy that we develop. If we forget that, if government forgets that, you know, we hear a lot about how much is being spent on various things. The best people you listen to move forward, which I have not seen too much of, are the people that are in this room, the disabled. They know best what is best for them. I know within our organization we had one of our member groups, the Severely Disabled Organization. I remember sitting around a table meeting with the compensation board, and he said to me, he says, "You tell them this." You know what I said to the gentleman? I said, "You tell them, because I don't know what you're going through, how you're living your life every day. You're the one that can tell the best story on what you need." And that's a message to any organization, that, particularly with government, that they must listen to. So just a comment, I want to thank all of you for your presentations. Very well put. Thank you.
Thank you, Carl. Would any of the panelists like to respond to Carl? Okay. Emile, in the middle?
Oh, sorry.
Okay.
First, I just want to thank the panel. Great information. Wendy from London. Great information and a lot of good discussion even amongst ourselves at our table. My first question is for Kristen. You talked about early intervention, and I'm just wondering if there's any statistics if early intervention is not done by either the employer and or agency, i.e. WSIB, and if so, where can those stats be found and what was the result of them?
Krista or Kristen?
Sorry, Krista.
Oh, sorry. I thought the question was directed to my
Wasn't it
colleague.
you that talked about early intervention as well?
Yeah, I mean,
Okay.
I don't have some specific stats on me, but the idea is that we were just really focusing on, and that what the research tells us that, is that if you can support the individual as soon as they identify employment as being something that they want to work towards, the sooner the better. Any kind of employment, then you have to really work with regards to the supported employment model. And I don't know if this is helping to answer your question, but with regards to the supported employment model, the idea is that the individual is the leader of that type of support, that they direct the type of employment that they're looking for, and the employment meets them where they're at. We know that we can't just suggest a job to somebody if they don't have an interest in, working in a bakery or working in a kitchen. And if they're interested in doing something very specific, then we have to meet them where they're at. And so if they identify employment as one of their recovery goals, then the sooner that we can work towards that in terms of early intervention and earlier supports and attachment, the better the outcome.
Okay, great. And that research, you have access to that we could connect with you after?
Absolutely, I'd be happy to connect you with those
Great.
resources.
Thank you. And my second question is for Bob Blakely. You talked about the incentive program, and I'm just wondering if that incentive program was tied to health and safety, because there is historically incentive programs that are tied to health and safety. When you talk about 13, I think you said 38 million hours.
42.
Sorry?
42.
Oh, there must have been some, I wrote it down wrong.
That's okay.
But that's a lot of hours to have absolutely no incidents or accidents that need to be reported. And it's very common with incentive programs that there's peer pressure because we've gone 30 days or whatever the case may be, that they're not going to report those injuries or accidents. And then later on, when they develop chronic problems, they will not be protected. So I just wondered if you could elaborate on that program?
Sure. Most of the programs, whether it's Hebron or Syncrude or any of the other jobs that have those sorts of programs, generally speaking, if there has been an incident of some sort, or so there has been an injury, may not be a lost time claim, but there's been an injury, the injury is reported. The injury progresses through a WCB claim. It may be a no lost time claim, but you've got that in the event that there is going to be a recurrence or an aggravation later on. So in terms of incentive plans, my own view of them is this. If the employer has a safe workplace, he gets the work done more quickly, has better morale on the job, the work is probably done right the first time, there's money saving there. Simply getting a handout from WCB, however described, in my view, doesn't make anything better. Because with the incentive plans, you can even have, if it's over a 5-year average, you can even have some incidents and still get the money back. Take the money and use it to make a safer workplace and to do more innovation that will cut out workplace injury.
Thank you. I'm all for a safer workplace, and especially, in unionized shops where there is a little better protection. That's great. And some of us are from non-unionized workplaces that didn't have that protection. But I am still concerned that incentive programs in general have definitely been an incentive to not report injuries.
To go underground with stuff? Yeah, I agree. I think that is certainly the case in some workplaces.
So despite that being the history of incentive programs, you still choose to have that program?
In some cases, I would say yes, because some incentive programs are managed appropriately and actually get to the goal. Some of them work. I think you need to be judicious in determining whether somebody gets the dough or not.
Right, and remember that a lot of that peer pressure happens when you're not right there, but thank you, I appreciate that. No.
We have a bit of a list. Emile has somebody over here, then Steve, and then back to this mic over here.
Hi, I'm Janet. I'm with the Canadian Injured Workers Alliance. First, I wanted to say thank you for this experience because it's been amazing. My accident employer is a caregiving, but they're an organization, nonprofit that does caregiving, and to the world they're amazing. Become an injured worker, and it's not good at all. And I listen to the work that is being done, and I feel really hopeful that yes, we can do great things, and I'm looking forward to CWA being a part of that. One thing that kind of came to my mind was talking about these getting the employers on board to realizing and to getting to know persons with the abilities, what people with disabilities have to offer. And maybe one thing that kind of came to my mind was like if we have like an ambassador system and bring it across the country and invite employers like, you know, this is something really good. Take not only, yes, this is a great idea, but become involved, become a part of it. And I really hope to see great things.
Thanks. Steve?
Sometimes I'm a little bit slow on the uptake, but Carl, in his comment, talked about encouraging others to communicate. And in our Community University Research Alliance project, we developed a program called our Injured Worker Speaker School that has now morphed into a program that's spread to a number of communities that are not just focusing on injured workers, really people facing barriers to participation. And what we've seen is that when people are able to articulate effectively their thoughts, their feelings, their needs, their wants, their lives improve substantially. And when we talk about roles of advocates, the same. Like, we encourage all of these programs to involve people with disabilities so that we can give our lived experience to the discussion. But when we're then able, as individuals, to be that critical thinker, to be articulate, people hear us much more effectively. It's a program that runs for 14 weeks, one evening a week, that teaches public speaking and leadership skills, but also places your individual experience into a broader social context. And having worked in rehabilitation and the workers' compensation thing, I've never seen anything work as powerfully to help people gain the confidence so that they can take the risks, so that they can be innovative and think kind of outside the box and then problem solve and move forward. And if you want to find out more, speakerschool.ca.
Great. Thanks, Steve. Back microphone and then table up here, okay?
Great, thank you. I'm Elizabeth with the CCRW, and I have a question for Jamie. Jamie, in your view, what are the best practices or needs as we move forward in working collaboratively between employers, community agencies, and government to advance the employment of people with disabilities?
Thank you for that question. It's a really good question, and it puts me on the spot. I have seen many more things that are positive than are negative, but I feel that the negative has the most space. Does that make sense to you? Okay. So your colleague on the panel here, I think, has said probably the most direct statement that I feel is the best practice. In my experience, and this is 7 years of Disabilities Mentoring Day, added onto my experience as an employer trying to do this. In 2008, when we began this journey, and by this journey I mean the strategic focus on ensuring that our hiring strategy was barrier-free, I spent myself personally over 10,000 hours of research in the beginning trying to figure out what it was that we were supposed to do. What I learned from that was too much, to be quite honest with you. Had I had someone that would have worked with us to say, here's how, wow, I could have saved myself a lot of frustration and time, but I also would have learned how to better utilize the information that I was gathering. And I think that I experienced that so that now when I talk to employers, that's the conversation. There is no employer in the world that I've yet to meet that would have done what Dolphin did. And the reason is because we were willing to do that because our focus was on that. But really, honestly, the nature of our business was not figuring that out. We just saw it as an avenue for our business. That's the difference. Most employers have a mandate, something that they focus on and execute every day that doesn't facilitate the time nor the expertise to figure this out. So by identifying that employers need tools on the execution of the how, to me, that's the best. I'm thrilled to hear that that did not come out of my mouth, because I've been saying it, and it's wonderful to see an organization that recognizes the value of making that connection. The reason why we founded Disabilities Mentoring Day was to connect the talent and have that coordination between the employment support organizations and the businesses, and have that B2B contact, because it's an essential piece. Government comes into play because they have the ability to have what I call the Hawkeye view of everything that's going on and everything that they fund, so they should be able to identify the gaps and be able to say, here, you guys work together, and here, you guys are working on this over here, you can marry that up with what you're doing. Dolphin's developing something called Dolphin Insight right now, which is a predictive and analytic tool that facilitates that matching algorithm that we use. Put that in the context of the tools that he already knows works with the employers. Trust me, we will see percentages rise. Not only are employers looking to hire people with disabilities, or let me rephrase that and backtrack, employers are looking for talent. If by helping them facilitate the process of identifying a way to enable them to A, keep their employees working if there's an injury or an illness in the workplace, and or B, hire, retain, and promote talent who are people with disabilities, trust me, they're going to do it, because we're saving them money. We're facilitating their work process. We're helping them as a resource. We're not the answer. We are part of the answer, and that's where the success is.
Thank you.
Thank you, Jamie. Table up front.
Good morning. My name is Gary Malkowski from the Canadian Hearing Society. Thank you all for your thoughts and ideas in developing an action plan. I have two questions. One to Jamie at Dolphin and Christian in New Brunswick, and your employer support service. What is the best approach, or what do we need to include in a national employer strategy? I'm interested in what you're thinking about, and I know, Jamie, you've alluded to some of that again, so I'm trying to frame it in a different way, because we service the deaf and hard of hearing, and we face challenges with employers in seeing the talent within our community. So specifically for deaf and hard of hearing, what should we include in an employer strategy? From your experience, can you share some of your successes and what you've seen from an employer perspective, and what are they interested in hearing? And Christian, the employer tool that you developed, is it posted online?
Who'd like to go first? Kristen?
The information that we developed, though, it's not necessarily online as we're speaking, because we are revamping our website, but technically it was supposed to be in the first place. But having said that, every time we meet employers, we always share the documentation and information we do have. In terms of what should be included in a program or a strategy, or in terms of tools that an employer should be getting and receiving in order to become disability confident employer, to be honest with you, I really don't know. I really don't know, and that's why we have a pilot project on the go right now. The research is being done as we're speaking, because there's a lot of things that we may think the employer needs to know, but at the same time we're not sure. So we have to, through the consultation about the Disability Competent Employer Initiative, we have to consult with various groups. There is an employer's perspective, but at the same time, there's the other side of the medal as well. As I said during my presentation, employers don't know what they don't know. So it's up to collaboratively working together, coming up with what employers should know. And at the end of the day, hopefully, we'll become with something that is really more complete, that will cover most of the aspects, and will, at the end of the day, make a significant impact on creating greater opportunities, basically. Does it answer your question? I feel like I answer like a politician.
Okay.
You qualify for politics.
I used to.
Thank you,
I believe
Kristen.
that.
Jamie?
Okay, try to fill in some of the blanks. So the best examples that I can give you are in this room. So we heard from Sodexo that they have a challenge with ensuring that they have a consistency in their supply of talent because they have talent turnover, but they also have a great quantity of employees. So their focus is ensuring that access to talent. So it's imperative that when they have job openings, we have predicted that and have people ready, not that we respond at the moment of request. We have Jazz gave a great example of someone that they've hired that due to the fact that they had to make a transition to accommodate the fact that she was hearing impaired, it positively impacted the safety record in the workplace. Access to that information is an imperative to remodel and to scale in other organizations with similar learned experiences and shared examples. Cooperative interaction is the key to success. We have a gentleman on the stage here who has spoken about Indigenous youth, Indigenous people who are looking for opportunities, and the barriers that they face are hugely different than the barriers that I face or that my colleagues face on an everyday when we're looking for employment. This is also part of figuring out the solution for everyone, because if we can figure out the more challenging pieces, the rest of the pieces will start to resolve to have better solutions because of that. It's by that collaborative approach and that is the national model in my hope, is that we recognize the value of understanding that a company and organization that facilitates the employment of that many construction workers, that is looking for 500,000 people, by the way, Disabilities Mentoring Day would be really good for you. When we're looking for that quantity of skill level, we have to figure out new strategies of not only ensuring that health and safety practices in the workplace are there, responding to injury in a very quick and efficient manner as he described, but also ensuring that we are predicting the need and reacting to that so that we are ready when it's there. We also heard from the mental health component of it. This is the future of work. In order to meet the needs who are suffering in the workplace, either quietly or by virtue of recognition now with some of the things that are going on, we must ensure that in all of this, we are not exacerbating problems and creating new barriers to success by focusing on what we know, what we can predict will happen, and how do we develop strategies in place to ensure that our workplaces are healthy and for people to live their lives there.
Thank you, Jamie. We're at 12:06. We have approximately 10 minutes left, so I suspect that big lineup down in the back of the room is going to, and we have more over here as well. So we have just 2 more questions left. Back in the room, and one mic over here. So back of the room first, and then we go to John Ray.
Thank you, and I'm going to try and make it fast so that everybody can get a chance to say something. Susan Gazarowski again from the Social Sciences Humanities Research Council of Canada. And I wanted to first off say I appreciate all the injured workers, all the disabled workers out there for sharing their stories, because myself, coming from the employer side, I now have a better understanding of some of the obstacles you guys have faced. One thing that I would like to put out there to echo what Mr. Latin said, and Jamie said, information is going to be key to make this process work. As an example, I've been racking my brain over the past couple of weeks to figure out how am I going to bring a post-concussive employee back to work who cannot handle light, who cannot handle screens, who cannot handle noise. Today was a perfect example of I found a solution. We got to get the information out there, and there's got to be a venue as well for employers to learn how we can best accommodate people with disabilities, from post-concussion to mental health to full-on physical disabilities. So I invite everybody out there that if there is information, share it with your colleagues, share it with your teams, because that's how we're going to make this work.
Great, thanks so much. Okay, Mr. Ray, you get the last question, and I do apologize to those down in the back who aren't going to get their question answered, but please seek out our panelists during lunch and they'll be happy to answer your questions. Apologies for that, we're really tight on time. John Ray, you're up.
I get the last word, eh?
You get the last question.
All right.
Not so sure about the last word.
No, okay, no, I'm gonna take the last word.
Okay, go for it, you got 2 minutes.
I wanna say that in 42 years I've been doing this work, I have rarely been at an event where there has been so much positivity. and that's refreshing to me. Unfortunately, if I have the last word, I'm afraid I have to be Carl number 2. Carl, I learned half of what I know from you, my friend. But since I've been here, I've enjoyed the conference, but we've heard a lot about using research, we've heard a lot about collaboration, we've heard a lot about people wanting to do things, we've heard about the business case, something we already know about, which is fine. But there's a problem, friends. In 42 years, I've only seen the percentage of our employability increase marginally. That's what statistics tell me. I know I'm one who takes the adage there are liars, big liars, and statistics. But this one I keep hearing over and over and over again, so even I believe it. So clearly there is a disconnect here. Employers aren't buying it. When the federal government released a couple of anti-poverty reports a few years ago, the ministers were responsible to respond, and they did. And their callous response was roughly, there is a solution to your poverty, go get a job. And many of us want to. But the question is, where the hell are all those jobs that we're supposed to go and find? Is there an employment genie in here somewhere? I keep looking for it, and I can't yet find it. Where are all those jobs we are supposed to go and get? And as we continue to mechanize, and with the increasing onset of precariousness and the future of artificial intelligence, I'm afraid that our employment situation is going to get tougher and not easier, and that is a problem. So I have not heard anybody trying to address the disconnect that is the reality that I see in all the work that I do. Thanks.
Thank you, John. Any of our panelists like to respond to John?
But if I may, though, this is why, we figure, in New Brunswick, based on our experience with employers, we figure we need to go to the next logical step because, the status quo was not acceptable. Let's put it this way. We spend time, effort, and energy in trying to make a change. And we were not getting the results. So we came with the idea about the Disability Competent Employer Program based on our actual findings. And we strongly believe that hopefully, with our assistants, like with my new friends on the stage here, and especially Jamie, when she talks about, making sure that we can measure success, hopefully, we'll get the funding to have another conference next year or in 2 years from now, and evaluate the impact on any new initiative, because we need to come up with ways to measure every initiative that's being taking place right now. And I strongly believe that the Disability Competent Employer, if we can come to an agreement and proceed with this at the national level from coast to coast to coast, down the road, hopefully we'll celebrate new numbers next time we'll meet, hopefully. That's what we're looking at right now.
Thank you, Kristen. Steve?
What I heard John say is that oftentimes it feels like the government is saying the solution is move into employment. And it's not an either or. We need to have income security so that people can actually have the ability to look after their immediate needs and then move into employment. So we need both, and we need the innovative approaches. I wish I could have worked for Dolphin Digital. I think it would have been so much fun, I
wish you could have too.
So we need to provide the opportunities, but in the meantime, we need to be able to provide a decent standard of living, and that's our challenge.
Great. Thanks, Steve. So I'm told that we've got a bit of time left because the minister hasn't arrived. So if I could get the few folks who are in the back for the mic, that'd be great. You have an opportunity to ask your question. We've still got a bit of time. Minister's not here.
Wonderful. I'm
It's
grateful
awesome.
for that. Hi, my name is Dr. Kathleen Thompson. I'm with the Council of Canadians with Disabilities. And I'm also with the category of you got to see this and driving what's next. Because in my daytime job, I'm a consultant to the legal cannabis sector. And I'm really concerned about legalization with respect to people with disabilities in the workplace, because cannabis is hugely popular and it's very complicated for accommodating cannabis in the workplace, particularly for the construction industry and other sectors. So I'm curious about the panelists' experience, if they've had any corporate experiences with organizations preparing for this topic, and also the Mental Health Commission of Canada. I'm interested if you're looking at this issue as well. And then in terms of finances, the cannabis sector is the fastest growing industry, growing at a faster pace than any other industry has ever grown, and it's the largest economy in the world. I've just returned from Las Vegas in mid-November, where I was at a business conference with 18,000 people, and I spent the entire week looking for companies that were progressive about disabilities and employing people with disabilities, and I did not find that. So I really also want to advocate for people with disabilities to be involved in the industry. It's an excellent industry, particularly for Indigenous communities who are very well positioned for this industry. So I'm interested in any comments from the panelists about this topic, and I would just encourage all organizations to start talking about this issue, especially unionized workplaces, because accommodating this is very significant. And cannabis has been evidence-based to help a lot of people with disabilities, particularly with chronic pain. So when we talk about reducing suffering, this is driving what is next. So I would open that up to anyone, particularly Bob, because the 1.5 million construction workers are really impacted by this.
A significant number of people are in a four-armed flap over the legalization of marijuana, particularly around safety-sensitive positions.
Absolutely.
The difficulty with medical marijuana is you don't get a dose, you get a license to possess.
It's actually medical documentation, not really a license, but indeed, yes.
Fair comment.
Yeah.
License in the legal sense as opposed to in any other sense. We have the Canadian Medical Association that says we don't write prescriptions for this because we can't manage the dosage, and we do not necessarily agree this is a good way to go. We have a significant number of people who say, this helps me, therefore it must work. We have another segment that says, THC no, CBD yes. As it sits now, we have a significant number of people who are affected by drug and alcohol testing programs in workplaces. If someone is taking codeine, OxyContin, you name it, as a painkiller, the theory is they report the usage to their employer. The employer, on a confidential basis, is to make an assessment as to whether or not the person can work safely. If they can work safely, then they can work at 100%. If not, they have to look around at how they can be accommodated. To say that it works badly is an understatement. But at least there is some semblance of order in that. We do not have cutoff limits around the use of marijuana that seem to be based on any science whatsoever. What we've got is the American DOT, depending on how you're testing, 50 and 10 or 8 and 4. Short answer is no one has put any thought into that. My own personal view is we are blundering into where we're going to go, and we have not addressed things as simple as when are you too stoned to drive. So when are we going to be determined to be too stoned to be affecting the high voltage cable that can fricassee everybody in the building.
Oh, absolutely. So well phrased, Bob, and very complicated. So thank you for flagging that. And I think that it's really a topic people should look at for future. And
Thank you.
And thanks again for the panel.
I think
Thanks,
there's
Kathleen.
one. I think there's one last point
Quickly, please, the
on the
minister's
use
here.
of marijuana. The use of marijuana it does make some people's lives better.
Thank you for that.
Having
Thank
said
you.
that, we have to do something around that.
Great, thanks so much.